Hello, I'm Dr. Stephen Pipe, and I have the opportunity to share with you an oral presentation that will be given at the ASH 2023 annual meeting. This is on the long-term bleed protection, sustained factor IX activity, and reduction of factor IX consumption and safety of hemophilia B gene therapy. And this is derived from results from the HOPE-B trial over 3 years following administration of a single dose of etranacogene dezaparvovec in adult patients with severe or moderately severe hemophilia B. So if we look at the participants in the trial, there were 54 who received a single dose of etranacogene dezaparvovec. The mean age was 41 and a half years. About half of the patients had history of hepatitis C. Just about 5.6% of the patients had comorbid HIV infection. And if we look at the distribution of pre-existing AAV5 neutralizing antibodies, 38.9% of the patients were NAb positive. When we look at the annualized bleed rates, comparing their 6-month lead-in compared to when they reached steady state factor IX expression, so between months 7 all the way through 3 years of follow-up. For all bleeds, we see a 64% reduction from the lead-in phase where the ABRs were 4 and a reduction to 1.5. But we also see similar reductions in bleed rates from 60 to 80%, whether we're evaluating treated bleeds, spontaneous bleeds, traumatic bleeds, or joint bleeds. And this demonstrates superiority to prophylaxis in the lead-in period through 3 years of post-treatment follow-up. If we look at the total number of bleeds per year of follow-up, there were 136 bleeds in the lead-in phase. And then when we look at year 1, that was reduced to 55. In year 2, it was reduced to 48. And in year 3, it's been reduced to 37 bleeds. This is now encompassing 52 patients who are responders on the trial. 61% or 33 of the 54 participants have experienced no joint bleeds over 3 years of post-treatment follow-up. If we look at the endogenous factor IX activity levels over time, at year 3, the mean endogenous factor IX activity is 38.6, and the median is 36. And if we look at the interquartile range, it's from 29.5 to 48.1. So overall, we're seeing stable factor IX activity levels over 3 years post-treatment. As far as looking at the brackets of where patients have settled into different bands of factor IX expression, 87% of the participants are remaining in the mild and normal range at 3 years of post-treatment. Just about a third of the patients are in the normal range, so between 40 and up to 100% activity. And then another half of the participants have factor IX levels between 12 to just under 40%. As far as their factor IX use over 3 years of follow-up, 51 of the 54 participants are free from continuous prophylactic factor IX infusions through 3 years post-administration. 46.3% or 25 of the 54 who were dosed have received no factor IX infusion over a 3-year period post-treatment. So overall, there's been a 96% reduction from factor IX utilization in the lead-in period. Important safety issues: no treatment-related serious adverse events. There was 1 death and 1 hepatocellular carcinoma that were reported in the trial, and these have been evaluated as unrelated to treatment. We've seen no factor IX inhibitors and no thrombotic events. Overall, there were 9 participants through 3 years of follow-up who've had ALT increases, and this triggered a course of corticosteroids. All patients were off their corticosteroid treatment within the first 6 months post-treatment. So overall, throughout 3 years of follow-up, the participants have demonstrated significant reductions in ABR compared to the lead-in Factor IX prophylaxis period. The Factor IX activities were stable with a mean of 38.6% through 3 years post-treatment. Factor IX replacement use has been significantly decreased from baseline by 96%, and no new safety events have been reported. Safety profile is assessed as favorable and consistent with previously presented data. So thank you for the opportunity to share this.